So it's not only physical exertion that can get things to flare up, it's mental and emotional exertion that can also make it flare up?
Exactly. When we first started seeing patients with post-acute COVID syndrome, a lot of the work that we typically do pre-COVID in my practice is focused around helping people with traumatic brain injury, post-concussion syndrome, and other less common conditions such as Ehlers-Danlos syndrome, where patients have a condition that we call dysautonomia, which is dysfunction of the autonomic nervous system. So we have a nervous system in our body called the autonomic nervous system, and it's focused on controlling all of these things that you don't typically need to think about. So when your heart should beat, when you should sweat, when you should feel cold, when you should feel hot, all of these little things that your body just does automatically. You don't consciously think about it. Any sort of trauma, whether it be immune-based trauma, which is what COVID causes, or physical trauma like a traumatic brain injury, can knock this system out of balance. All of a sudden, you start to see all of these very unusual symptoms. They're very hard to measure. I can't tell you how many times we've heard from physicians, well, I ran all of the regular testing and everything seems fine. Everything's coming back normal. Well, that's really common with dysautonomia. We see these invisible symptoms. We had a bit of a leg up on how to initially start to manage this and how to put a label on it, because as Dr. Papa mentioned, it's very important to be able to assist physicians in labeling things. So even if it's not exactly this is what it looks like. So let's start with management from there.